Hello everyone, I am Rialyn Salangron. I am going to perform cervical lymph node assessment. So first, the definition of cervical lymph nodes. It is a lymph node located in the neck region, especially around the cervical vertebrae. They play a crucial role in filtering lymph fluid and trapping harmful substances like bacteria and virus. And good morning, ma'am. I am Rialyn Salangron. I am going to assess your cervical lymph nodes. So first is position the patient sitting upright and ask the patient to tilt their neck downwards. Ma'am, can you tilt your neck downwards? Okay, ma'am. And then, relax your arm under your lap. And stand behind the patient and use both hands to palpate the lymph nodes. First is start under the chin or submental lymph nodes. Then move palpating beneath the mandible or submandibular lymph nodes. Then turn upwards at the angle of mandibular or tonsillar and parotid lymph nodes. Then follow at the anterior border of the sternocleidomastoid or anterior cervical chain down to the clavicle. Then palpate behind the posterior border of the sternocleidomastoid. Then palpate over the occipital lymph nodes and ask the patient to tilt their head. Ma'am, can you tilt their head? Yes, sorry. Then palpate behind the posterior border of the clavicle. Then the other side, ma'am. So, thank you.
Good morning, ma'am. I am Ann-Catherine M. Galinero, and now I will be performing on how to assess the axillary lymph nodes. So first is to perform a hand hygiene and wear clean gloves to prevent the spread of infections. So now, let's proceed to assessing her axillary lymph nodes. Before that, we ask the patient for permission to touch a certain part of her body during the assessment. Ask if the patient has any pain in either shoulder before moving the arm. This is to prevent existing discomfort or unnecessary distress to the patient. Next is begin by inspecting each axilla for evidence of scars, masses, or skin changes. It is essential for detecting any abnormalities that may indicate health issues. When examining the right axilla, hold the patient's right forearm in your right hand and instruct them to relax it completely, allowing you to support the weight. This allows the axilla muscles to relax. This relaxation is easier access to axillary region and enhance ability to palpate effectively. Palpate the axilla include anterior, medial, posterior, lateral, and apical group of lymph nodes. It is essential for assessing the health of lymphatic system and identify abnormalities. Repeat the assessment on the contralateral axilla. Use your left hand to hold the patient's left forearm. Palpation enables the detection of enlarged or tender lymph nodes, which may indicate infection requiring further treatment. Based on overall assessment, there is no signs of enlargement or tender lymph nodes. There is also no signs of inflammation, so the overall health is normal.
Good morning everyone, I am Ian Emmanuel D. Ragas from FA1 BIS N101-C. For today's video is we are going to perform the inguinal lymph nodes assessment. So at first is we need to gather our equipment and we must provide patient privacy and we need to tell the procedure to the patient. So as you can see, here is our patient, and then we are going to ask our patient to remove his trousers and underwear. So again, we are going to provide patient privacy, and after that is we are going to palpate the inguinal area of the patient, the inguinal lymph node of the patient, right here. Nga man din natin. So din na to i-palpate if naabay kaning bukol. Pero makita na to na siya pinakauna pa lang kung nandiyo siya ay bukol kay magtibugol niya hang party sa yung lawas. So din na to i-palpate dayon if and then we are going to take note na lang dayon kung naman lang galing mga abnormalities din sa yung inguinal area. Mana?
Good evening, everyone. I am PJ Cortez from FA1-101. I'm going to demonstrate an assessment of the epitrocular lymph nodes. So I already performed a hand hygiene and I already wear my gloves, and now I'm going to introduce myself to the patient. Good evening, sir. I am PJ Cortez, your student nurse from the Cagayan de Oro College. I'm here to perform an assessment on your epitrocular lymph nodes. So is that all with you, sir? So can you please state your name, sir, and your date of birth?
Albert Cortez, May 22, 2004.
So do you have any concerns or questions, sir, before we start?
No nurse.
Palpation of the epitrocular lymph nodes. I'm gonna elevate the arm 90 degrees on the elbow flexion, and I'm gonna take my hand on the underneath the groove between the biceps and the triceps, 3 centimeters superior of the elbow crease, and I'm gonna use circular palpation to find the epitrocular lymph nodes. Do you feel anything, sir?
Examining the patient's abdomen can provide information about his internal organs. Always follow this sequence: inspection, auscultation, percussion, and palpation. Changing the order of these assessment techniques can change the frequency of bowel movement and make your finding more accurate. Inspection consists of visual examination of the abdomen with note made of the shape of the abdomen skin, abnormalities, abdominal masses, and the movement of the abdominal wall. With respiration, auscultation of the abdomen is performed for detection of altered bowel sound, rubs, or vascular growths. Normal peristalsis creates bowel sounds that may be altered or absent by disease. Irrational of serosal surface may produce a sound that rap as an organ move against serosal surface. Palpitation is the examination of the abdomen for crepitus of the abdominal wall, for any abdominal tenderness, or for abdominal masses. I'm going to start with the patient belly. So the patient abdominal is flat. If there is a little rounded, that would be okay. It's pretty symmetric as well. I'm going to look at the abdomen overall for skin color and any common place for moles. For the movement, I should see normal respiratory movement of the abdomen, which I do see, and also row here in the epigastric area. I see many times the pulsation of the aorta, so that is the normal. This is a common procedure in physical examinations in the medical field. The general contour and symmetry of the abdomen can provide clues to the presence of any masses, size, or other abnormalities. Distinction of the abdomen can indicate.
Good afternoon, ma'am. I am Aprilin Lavador, and today I will be performing how to assess neurological assessment. So my definition for this, it refers to the process of evaluating the patient health status, including physical, mental, and emotional aspects to gather information necessary for ongoing care. The purpose for this to identify any existing medical conditions or concerns and to detect any new health issues or changes. And then the principles is assessment should cover all the relevant aspects of the patient health, including the physical, psychological, and social and environmental factors. Then, before proceeding the procedure, so I will perform first hand hygiene and wear clean gloves. So it is essential for us to maintain infection control. So let's proceed. Good afternoon, sir. I am Aprilin Lavador. I will be your student nurse for today. I am your student nurse for 2 p.m. to 3 p.m. So, sir, could you state your name, please?
My name is James Carlo Harangman.
And then, how about your age?
I'm 20 years old.
Then your birthday?
December 4, 2000.
And I will check your wristband for confirmation. Okay, thank you, Sir James. So, I'm here to assess your neuromuscular assessment. So, and to be able to do that, may I ask permission first if it's okay with you if I will touch your certain parts of your body? Okay, thank you, sir. So, let's start. So, first is perform subjective assessment. So, sir, naba kayo nabatian karong sakit sa ulo? Naba ka sakit ba yung iya sa badiha? Okay, sir. So, second is assess the level of consciousness of your patient. So, if imong patient is unconscious ba siya or kaning active ba siya or oriented, and then know ba niya kung asa siya karon? And then third is assess perla using pen light. Assess perla using perlite. So perla is pupil. Pupils are equal, round, and reactive to light accommodation. So sir, kaning mag-assess lang ta sa imong pupil, sa imong eye. So kanang ako lang i-assess imong eye sa if reactive ba siya sa light. So yan yung okay, your pupils are equal, and then symmetry, and then reactive to light. So, next is assess motor strength and sensation. So, sir, pwede ba nini mo sundon ang kaning object, pero kabera namang imong isa ka mata. Kabera imong isa ka mata. Then sundan din nimo ha. Okay, thank you. Okay. Okay, thank you, sir. So, ang iyang motor strength is symmetrical, and then coordination and fluidity movements. And then fourth step is assess his muscular strength. Do bilateral hand grabs. So, sir, kanang pwede ba nini mo siya i-push akong hands? Gamit ang imong left and right. So, left una. So, tanan na to ang iyang strength if weak ba or strong. So, sa pikas. Okay, so strong. So, okay ra, normal. And then after sa hand grabs, katong hand grips. So, sir, pwede nimo pumunta na kung kamot. Kanang pumunta yung pumunta yung kayo. Sa pikas. So, ang mas strong sa iya is ang kaning right niya nga kamot. Okay. So, assess the strength and resistance for upper and lower extremities. So, sir, pwede ba nimo i-move imong mga kamot? Okay, thank you. So, pwede ba ka matindog, sir? Imong tiil, ilihok lang.
Tikas. Okay. So the last step is assess his unanticipated and then last step is inote nimo imong mga findings sa iyang facial expression, iyang kanang extremity movements and speech. If na ba sa mga speech impairment, like kaputol-putol ba iyang inisultian or tubag, then ora to. So, ang post procedures, so, i-move na nimo imong gloves. And then, perform hand hygiene last. Okay, so, that's all. Thank you. So, thank you kaayo sir sa imong pag-cooperate sa atong assessment karon. If na kay mga concerns sir, ato lang ko sa nurse station ha. And then, tawagan ko sa nurse station, okay? Okay, thank you Sir James.
Good morning everyone. I'm Marisvi Palasan. I am going to give the definition, purpose, and the principles for cardiovascular assessment. So, cardiovascular assessment is a medical evaluation of the heart and blood vessels to check for cardiac health, detect issues like heart disease or hypertension, and monitor risk factors. It includes tests like blood pressure checks, ECGs, echocardiography, and physical exams to assess heart function and overall cardiovascular health. The purpose of a cardiovascular assessment is to evaluate heart and blood vessel health, detect abnormalities, monitor conditions such as heart disease and hypertension, and assess overall cardiovascular well-being. The principles of cardiovascular assessment include evaluating heart and blood vessel function, identifying risk factors and abnormalities, using diagnostic tests such as blood pressure measurement, ECG, echocardiography, and physical examination to ensure comprehensive cardiovascular health assessment.
Good evening everyone. So I'm going to demonstrate the inspection of cardiovascular assessment. So as you can see, I already wear clean gloves and perform hand hygiene. So I'm going to introduce myself to the patient first. So good evening ma'am, my name is Marisvi Palasan. So I'm going to be your student nurse. I am from Cagayan de Oro Colleges. So today I'm going to perform the inspection of the cardiovascular assessment.
So I inspect the patient. So she had regular heart rate of 60 to 100 beat per minute and had a symmetrical pulse and a standard blood pressure of 120/80. So there's no sign of abnormal findings.
So next, I'm going to inspect the face, the lips, and extremities for pallor and cyanosis of the patient.
Make sure the face, lips, and extremities appears pink and well perfused. There's no sign of pallor or cyanosis of the patient. So I place the patient neck for GVD in upright position. So I find there is no jugular venous distension, so there's no abnormal findings. This is the bilateral upper and lower extremities for color, warmth, and sensation. So the normal finding is bilateral upper and lower extremities exhibit normal color, warmth, and sensation, indicating adequate circulation and nerve function. So normal ang coloration and there's no abnormal finding. The lower extremities for hair distribution, edema, and signs of teeth, vein, thrombosis. So make sure the symmetrical hair distribution, and absence of edema, and absence of signs such as warmth, tenderness, redness, or swelling, which may indicate deep vein thrombosis. So normal jud siya.
That's all lang po, ma'am. Thank you for your cooperation, and if you have any concerns, just call me at the nurse's station, and thank you very much po.
Ayong butag, sir. Ako din si Fitzsigan Tobias, and I'll be performing the next procedure for this cardiovascular system assessment, which is the palpation. So with that, I'll be palpating and comparing your radial pulse, your brachial pulse, your dorsalis pedis, and also your posterior tibial pulse. And also, I will be palpating your nail bed for capillary refill. But first, I'll be performing the hand hygiene and also the wearing of gloves. Now let's start with our procedure. First is I'll be palpating your pulse area. First is your radial pulse. Take note of the presence of amplitude of each pulses. Next, your brachial pulse. Now for the normal findings, there must be presence of pulses that are palpable bilaterally with each amplitude. On the other hand, the abnormal findings exhibits an absence or diminished character of pulses in these arterial pulse points. The next step is to palpate the nail bed for capillary refill. Now for the normal findings, the nail bed should exhibit rapid capillary refill, returning to its normal color within 2 seconds upon release of pressure. Now for the abnormal findings, the nail bed has a prolonged capillary refill time, taking longer than 2 seconds for the nail bed to return to its normal color.
Good afternoon, sir. Ako si student nurse Diana Chidrome, and natong buhatan karon i-auscultate na ako ang imong heart. Okay ra ba, sir?
Okay ba?
Good day, everyone. I am Hanapo Malikay, and I will explain what my partner did. After her introduction to the patient, she then proceeds to auscultate the patient. And there are 4 parts of the heart that will be auscultated. The following are the apex, tricuspid, aortic, and pulmonary. The first thing that Miss Micaela did was prepare the diaphragm of her stethoscope and listen to the patient's heart. Following sequence. The first part of the heart that she auscultated was the apex. Second is the tricuspid, then the aortic, and lastly is the pulmonary.
Thank you, kay sir.